Okay, good afternoon, everyone. Welcome to today's Public Health Ontario Rounds presentation on COVID-19 mass immunization drive-through, a pilot. So my name is Tara Harris. I'm a manager here at Public Health Ontario in the Immunization and Emergency Preparedness team. And it's my pleasure to be moderating this session today. Before we start, just a few housekeeping items for you. We will remain in lecture mode for the duration of the call, so if there are any questions, please send them through the chat pod located in the bottom right of your screen. In order to hear the presentation, we do advise to log into the audio via telephone, landline, or cell phone to have the best quality audio. I'd like to state that as the moderator of the session, I do not have any potential conflicts of interest to declare. So it is my pleasure now to introduce the speaker for today's presentation, Katarina Garpenfeld. Katarina is the Vaccine Operations Chief for the Health Emergency Operations Center in York Region. Prior to this, Katarina was a Health Emergency and Business Continuity Specialist with York Region Public Health, in addition to being a registered nurse. So welcome, Katarina, and I will hand it over to you.
Thank you so much, Tara, and thanks everyone for joining this session today. As Tara mentioned, I'm here to talk about the mass immunization drive-through pilot that we executed in York Region earlier last fall. So I'm just going to make sure that you see when I'm advancing my slides. Okay, perfect. So just starting by saying that I have no potential conflict of interest to declare. And I'm going to move you through an agenda today that is starting with giving a very high-level overview of what we refer to as a flexible hybrid model for COVID vaccine immunization and distribution and administration. I'm going to give a quick overview of the pilot itself, and I'm going to speak a little bit about our key partners that participated and enabled this pilot to be executed. I'm going to provide some background and context to drive-through immunization more generally, and I'm going to speak a little bit more in depth about the different components of the clinic setup, mainly from an operational perspective. I'm going to speak to the evaluation and the results of the surveys that we did with the clients and staff that were participating in the pilot, speak a little bit about the successes and challenges, and finishing off with the outcomes and next steps that we are working towards here in York Region. So I have two polling questions that I'm going to put up through this presentation. So the first one, thank you, Lydia, if you can pull that up. And this is basically just asking if you have any experience with running a drive-through immunization clinic, as we know that we have some of our partners that have been doing it. So just kind of gauging from the audience what the experience are. Okay, perfect. So looking at it, it looks like there are a few with some experience in it, but the majority does not. And moving forward, I really will emphasize some of the operational components in the pilot for us and how we execute it from a practical perspective, as I think that is providing a lot of added value. So when we started planning for mass immunization in York Region earlier last year, one of the first actions we took was that we created a proposed model for implementation of mass immunization in the COVID context. And the aim was really to optimize the COVID vaccine distribution and uptake. And we were looking at a flexible, what we refer to as a flexible hybrid model, with main focus on the clinic types and the clinic setup. And the aim of this was really to ensure comprehensive coverage throughout the region, but also from a customer lens, understanding some of the barriers that might exist for people to access this type of services, and really ensuring that the type of clinics that we offer are aligned with the need of the regional residents in various contexts. So looking at this flexible hybrid model, it consists of a number of different clinic types. So still remaining is one of our baseline planning assumption is the use of multiple static large-scale clinics. In addition, we are looking to some smaller, medium-sized static clinic, some of them from a community-led perspective. And we are also working with something that we refer to as an outreach immunization program. And this program has several subcomponents to it. Some of them are already operational in the context that we are already started to roll out vaccine into our congregate settings, so long-term care and retirement homes at this point. So in this program, what we wanted to achieve was really to reach the residents where they are. Appreciating that within the COVID context, we For one, we want to really avoid gatherings and lineups, but we also want to ensure that our most vulnerable residents and those that may have, for example, mobility issues do not have to come to us, but we have the opportunity to go to them. So when we are looking at outreach immunization for congregate settings, so we created a number of strike teams consisting of public health staff together with our paramedic services partners as well as external local practitioners that went into the long-term care and retirement homes to administer the vaccine on site. We are also working together with internally, but also with several partners to offer a number of mobile and pop-up clinics. I'm going to speak to those a little bit later in the presentation, as it also aligns with the drive-through model. And in addition, we are working to some extent to look into the option for home care and ensure that we can enable home care recipients that may have mobility issues to access clinics and services as well. And then the last component, and which I will speak a little bit more to, is the drive-through clinics. So a high-level overview of the pilot. So when we started looking at this flexible hybrid model, one of the main components for us to understand was that those type of clinics that we are proposing, for which we may not have a large amount of experience within the region, we really wanted to get an opportunity to test drive them and to ensure that what we assume will work actually will work from a technical perspective. So what we did is that we used flu vaccine, and we utilized that to model and pilot certain components, some full-scale clinics, like you will see today with the drive-through, and some other components, more parts of it. We also did run a mobile clinic pilot together with our paramedic services using their multi-unit vehicle to provide immunization services as part of this pilot. So looking at this, just really to understand that it's feasible and we are able to execute a large-scale mass immunization drive-through in the COVID vaccine and immunization context. So the focus areas for the pilot was the clinic setup, the resource requirements, cold chain management, client and staff satisfaction, as well as the efficiency. So looking at the number of residents we can vaccinate over a specific time period and how that compares to other clinic types. So maybe more traditional clinic sites like large-scale static ones or mobile. So for this pilot, the target group was the family of staff and residents in the regional long-term care homes. And we executed the pilot in the parking lot of one of our local municipalities' recreation centers. And it took place on Friday, October 30th between 9 and 11:30. Some of the key partners, and it really should be emphasized that this was a effort that had many players in it, for which we would not be able to do this without them. So our Health Emergency Operations Center, all sections in various parts of it were involved and provided support in planning for and executing the pilot. We did receive a great amount of support from our paramedic services partner, both in the planning process, also acknowledging the fact that it is a different environment than what most of our staff is accustomed to provide immunization in, and understanding the actions to be taken and kind of increase the comfort level for managing any potential adverse reactions and so on. We received some great input and support from our paramedics, as well as having them on site the day off, actually providing the vaccine and immunizing. The town of Newmarket, where we executed the pilot, provided us the parking lot, the facility, as well as a significant amount of support in regards to planning around that specific property and understanding the pros and cons of different setups. And just at the day off, they were there providing us support as needed. In addition, we received support from many of our internal to the region partners, the transportation services, our York Regional Police, both in the planning as well as the day off, our health and safety and health equity, as well as corporate communication, our corporate customer service strategies, and our risk management from the corporation. So just providing a little bit of a background and context. So when we created the proposal for this flexible hybrid model to be executed in York Region for mass immunization in this context, we really had the focus of understanding any opportunities to look into more innovative strategies, and as well as really having the client perspective. So to some components, I spoke about it earlier, but it's really to understand, what is different in COVID immunization from the planning for mass immunization that we have done before. Where do we need to change our approach, understanding that we need to facilitate the physical distance as well as enhanced cleaning between clients, et cetera, and really minimizing the risk for transmission and exposure in the settings for both the residents and our staff. So we did a literature review, and we also took part of some of the work that has been done internally to the region prior to the immunization work, which was focused on assessment centers and the customer journey mapping that was done. In this customer journey mapping, there was a number of barriers identified for clients to access this type of services. And to really understand what those type of barriers could be, they did a quite in-depth investigation of those different areas, and much of it we assumed and can really see are applicable almost one-to-one over to mass immunization context. So that was our baseline kind of mindset when entering into the planning for this, that we wanted to make it accessible and as well as safe and efficient in terms of the number of clients we can run through. So we did see that there's a limited history of drive-through clinics and health services generally, but more particularly for mass immunization purposes. In the late 90s and the early 2000s, there were some health agencies that began to offer vaccine for flu in this type of format. So we did have an opportunity to take part of some of those learnings, as well as we have some of our local partners in the region and in other regions as well that did execute drive-through immunization during COVID for flu vaccine as well as the routine time vaccination programs. So they provided us a great amount of insights and lessons learned and identified some of the issues that we were working around to mitigate before executing this pilot. So what we assumed was that, and what we also got support from in the literature, was that it has the potential to be less resource intensive, so requiring less personal protective equipment, less disinfectants between clients, and as well as it's being highly beneficial for individuals with mobility issues. So what we saw in the literature was that staff and clients reported a higher level of satisfaction with this model and appeared to be favoring it over the more traditional walk-in clinics. So a number of the potential challenges that were identified both in the literature and through conversations and sharing lessons with our partners are listed here. And I'm going to just speak a little bit to some of the components, how we worked around to mitigate these and ensure that we had a safe environment for our staff and clients the day off. So the potential exposure of carbon monoxide is something that is one of the main components that are being noted in the literature. So we got around this in this specific context by being outdoors. However, being in the Canadian weather context, this is not always doable, and especially when we come into the colder months of the year, as well as for other kind of adverse weather events during other seasons. So knowing that, we were able to work around that potential issue outdoors, but we are, and I will speak to it a little bit further in the presentation, looking at opportunities for indoor drive-throughs or hybrid indoor-outdoors, with which added layer of caution to be taken in regards to carbon monoxide exposure. We did also ask our clients to shut off their vehicles at each station to not have the engines running and kind of generate additional exposure for the staff and the clients. So another component to consider is potential for vehicle accidents. There is for sure kind of a component of vehicles driving through the clinic in a very slow speed. However, we added some components of ensuring that we had a one-way clinic flow, so basically entering and exit in separate areas, as well as no opportunities for cars to enter in from exits or areas where we didn't want them to come. So we had off-duty police officers from York Regional Police the day off that blocked off the entrance where we didn't want vehicles to be able to exit, as well as supporting us kind of with the overall direction of traffic, and as well as identify potential areas for congestion or other issues that we could be faced with, especially if scaling up more to a mass immunization scenario. So one of the components that we also came across was the risk for syncopal episodes, as well as any adverse reactions to the vaccine, and some of the challenges that staff can face in regards to providing kind of medical care to a client that is strapped in a car with a seatbelt, and then the difficulties to accessing them, as well as the person actually being the driver of the vehicle, obviously adds layer of complications. So we received a lot of great input in preparation from our paramedic service partners, as well as having them there the day off, both providing immunization but also being available in case of a medical emergency was really a helpful component. And one of the other kind of points that stood out for us, and I spoke a bit about it, but it's really the staff well-being, to understand what is different in a drive-through clinic from a more traditional clinic site. So the weather and being outdoors being one of them, but also being on your feet and standing up for a long period of time. So one of the components that we have been looking for when we have been planning ahead is shorter shift length. and the opportunity to have an indoor lounge, very close proximity to where they work, so they can take their breaks indoors and go in to get warm and have something to drink, and take their breaks in a place where they can be comfortable and warm. The communication, both with clients and staff. So we provided quite a large amount of communication to our clients as well as our staff prior to the event to really prepare them for what they can expect and some of the actions that we will be expecting of them. So for an example, we did send them a confirmation of their appointment, so to be noted that this was a by appointment only clinic. There was no walk-ins or drive-ins or whatever to call it, but everyone that were attending had booked appointment before. And when they made that appointment, we did send them both the consent form to be printed and signed and brought with them to the clinic, as well as a fact sheet that we are providing in our regular clinics about flu vaccine as needed, as well as some other information of what to expect the day off, and the same for staff, obviously without the consent form and so on. We did also work together with our YRP partners as we wanted to have the opportunity to pilot the use of an FM radio station. So what we were able to do with their help was to record a message about the expectations and the actions to be requested during running through the clinic, as well as some more general COVID messaging. And we were playing that over and over, so to say. It was a quite long message, so they didn't have to hear it too many times, but it provided some good reminders and where they could access more information if required. And then it was the weather. And there's not too much to do about that. We had a really cold day, which was, you will see that in the feedback that we received both from clients and staff. However, there are some options to navigate around that as well. And so what we did, we had tents with side panels just to ensure that there was no added layers of cold from the wind, as well as hand warmers, as well as close proximity to an indoor staffing lounge where the staff could go inside during their breaks. So looking a little bit more at the clinic setup specific. So I appreciate that this is a small map to see. So I'm going to speak to it and then I'm going to break down each station within the clinic a little bit further. So if you see here, you will see up in the right corner, this is the entry from the street that is taking any cars into the area for which the recreational center is located. And they were driving in and they came to a first station where we had our greeters. And then once they had passed and kind of showed that they had, or we ensured that they had an appointment, they were directed to move over to the next station. If they didn't have an appointment, there was an exit line just close proximity to that station, so they never needed to enter into the clinic area. So the greeters ensured that they had a consent form. If they didn't, they provided them with one and ensured that they had an appointment and that they were on time for that. Once that was provided and confirmed, they moved over to the screening area. At the screening, we had 2 staff with healthcare background that were screening for any COVID-like symptoms. If the client didn't pass the screening, they were directed to exit there as well, as they would be not be eligible to receive the vaccine. And if they passed the screening, they were directed forward to the immunization lanes. So I know it's hard to see here, and I have some better picture, but there was 3 lines running. Within those lines, there were 5 immunization stations. So in 2 lanes, there were 2 stations. And in 1 lane, there was 1 station. And the division of that was that so any cars that had only 1 person in it went to the station where there was only 1 immunizer and 1 tent. So that was to increase the flow to be a little bit quicker. And vehicles that had multiple clients in them, they went as directed to one of the 2 lanes where there were more than 1 immunizer in it. And I also, it's a little bit kind of muddy to explain it, but as I go through the different stations, I think it will be a little bit more clear. You can also see here the police vehicle that was put to block out any car from entering in from what was our exit area. We also had the ambulance on site, as well as our refrigerator van for which we had the vaccine inside. So it was functioning as our vaccine depot at that day. We have marked out here the staff lounge that was inside the recreation center, very accessible, which was much helpful. And we also have entered here the staffing parking, or showed here where we have the staffing parking. So moving into each station, so this is just, we had the opportunity for our police colleagues came out that day and did some aerial view photos which was really helpful to get a good overview of the flow and understanding the pros and cons of different setups and to see how we could anticipate that the clients would run through. So that provided us with a lot of good insights, both the day off as well as after when we were going through our evaluation of the process. So I spoke about this. So station one was check-in. There we had greeters basically just confirming that they had an appointment and that they had a consent form. And if not, they were directed to exit. If yes, they were proceeding into the next station. And as mentioned, it was by appointment only, which really made a huge difference for us in our ability to spread clients out over the clinic period of time, as well as ensuring that we can navigate any anticipated congestion before it happens. So as they passed, they moved on to the next station, which was the screening. And we also had a number of staff functioning as line managers. So the YRP, or our police partners, really were the one who directed traffic. However, we had some line management staff ensuring that vehicles were progressing as they should, going into the right lane as directed, which was also very helpful. And as the clients were moving into station 3, which is the vaccination lanes, so here you can see the tents that were put up. And in this area, there was, as mentioned, 2 immunizers in the tents that were receiving cars with more than 1 client, and 1 immunizer in the tents that were receiving the cars with 1 client. We also had a vaccine supply nurse that were providing the support with the vaccine, as well as kind of moving between the refrigerator van and the vaccine, filling it up and checking the temp logs for the coolatrons in the tent. And I should note that one of the challenges that we did face that day that I know is not reflected in the evaluation form was that it was really cold for the vaccine. We had one opportunity in the morning when I think it was actually -2 degrees Celsius when we started. We had to take some of the vaccine back into the van to kind of ensure that it didn't go below the point of temperature for which we are able to work with the vaccine. So that's just kind of a parenthesis of one of the challenges that we faced. We also had a runner that was supporting all the immunization stations with supplies filling up so that the immunizers never had to leave their station to get any supplies or anything needed for them, as well as the runners was also dropping off heat warmers as needed and anything else that they were asking for. So the immunizers, they checked that the person had the consent signed, and then they immunized. They provide them a timestamp and directed them over to the recovery area, noting to the client that once 15 minutes has passed in the recovery area or the post-immunization area, they are okay to leave. However, we had staff observing them in the post-immunization area as well. So once they were immunized, and one of the components in regards to immunization that was also noted in the literature and that we had many discussions around was the immunization of children. So what we did, we had, and you will see in the evaluation, that we had a range of all ages. I think the youngest that we had was just a year or a few years old, up to late 80s. And so what we directed parents was that if the child could remain in their car seat, then that was okay. However, if the parent wished to or the child was upset or it was difficult, the parent took the child out of the car, moved them with the child to the passenger seat, kept the child in their lap, inside the passenger seat on the car, and then they put them back. So that worked really well. We didn't have any issues or any instances where we had problems. In some occasions, it took a little bit longer to navigate around families with small kids, but there was really no direct barriers in regards to that. So in the post-immunization area, we had 3 staff with healthcare background as well. They greeted the clients when they came and directed them to a parking spot, reminded them to turn off their vehicle, to honk if they required any assistance, as well as them obviously circulating around to ensure that everyone was doing well inside the car. After 15 minutes, they were okay to leave, and they were expected, as mentioned, to keep the time for themselves based on the timestamp that was provided to them by the immunizer. So looking a little bit at the evaluation and the results. So we had the opportunity to work with our program evaluator as well as one of our customer experience specialists to develop surveys for the clients as well as the staff to really evaluate and assess what went well and what was challenging and what we could do better the next time around. So looking just at the overall results. So we had 47 cars participating. There were 94 people immunized, with the majority of the clients immunized within that first 1.5 hours. The distribution of age, you can see, is quite broad. So the absolute majority of people were between the age of 19 to 64 years, but it was spread out over a large range of ages. The throughput time for clients, so we had, in addition to our staff that was working in the clinic setting, we had a number of evaluators that were following kind of random cars and timing them in the different stations just to see what is the overall time it takes for a car to go from greeting to the post-immunization area. So not looking in those 15 minutes where they need to wait to ensure that there are no adverse reactions. And for one client cars, it took approximately 10 minutes. For cars that had 2 or more clients, it was not much longer, but approximately 11 minutes, and then adding to that the 15-minute observation time. And it should be noted here that some of our partners that have been doing drive-through immunization for flu, once there's an opportunity to do that over a period of time and really work through some of the administrative challenges to ensure that if the client can provide online consent before, and that you have a number of kind of speeded up processes, you can increase the number of clients that you can run through a drive-through quite significantly. So these results are based on the circumstances and what was put in place for us, but I do want to note that there's likely a good opportunity to push those numbers a little bit further with experience, as well as really assessing the process for administrative tasks throughout the clinic. So in the client feedback, so among the clients, we had a 72% response rate. And among those that responded, 91% were overall, of the percentage of clients that were very satisfied or somewhat satisfied, we saw that 90% of them with the overall experience, 88% with the online registration setup, and 88% with the staff support. The 91% stated that the instructions were clear, and 94% stated that the signs were clear. And as you saw in the pictures that I showed earlier, we had quite large signs for all different stations, just to increase that level of comfort for the client of knowing, both directed by staff, but also kind of visual large signs of what part of the clinic that they were approaching, we felt was really helpful. So looking at some of the key performance indicators, so 94% stated that they would participate in a drive-through again, and 100% stated that they would recommend this drive-through to a colleague or a friend, which is a really great outcome for us. We did have some set questions and also some open-ended ones. So after pulling them into themes, what we did see from clients that they liked the most was really that it was fast and timely and convenient. So that people were very helpful, and it was in a timely manner, and it was efficient for families with small kids, as they could just kind of remain in their car and run through. A lot of people felt safe as they were able to stay in their car, and there's a minimum amount of interaction with other clients. And one of the components that we did see in the assessment center journey mapping that I spoke to earlier was that people are feeling uncomfortable coming into settings where they fear that they might be exposed or that they fear that there is a risk of transmission. So that was also really one of the driving factors in finding ways to have people be able to run through this clinic with a minimized risk of exposure. They also felt that the staff was friendly and supportive, and we had a really great team that day, as we have all days. And some suggestions for improvement, so the weather. And again, it's hard to navigate around the weather itself, but the option to have indoor indoor drive-through as well as a hybrid model of indoor-outdoor will support. From the consent form perspective, they were talking about online consent form and that some had issues accessing the consent form that we provided them, and then subsequently weren't able to bring it with them. Some other points that were raised was more hours of operation and to remind people to bring a blanket, which is a really good point, just ensuring that when we are sharing information and we are preparing clients to come to this type of clinic, if it is outdoors, we are asking them to turn off their vehicles. It is good to ensure that they have proper clothing and potentially also blankets if it is cold sitting in the cars waiting. Looking at the staff feedback, so we had approximately 58% response rate for the staff feedback survey, and we also did an end-of-day debrief on site when we had finished off the clinic to just gauge kind of their immediate experience and thoughts and any concerns that they had experienced throughout the morning. So the percentage of staff that were very satisfied and somewhat satisfied with overall experience was 96%. With the written instructions that they received is 94%. The assigned goals 94% as well, supporting resources 86%, and clinic scheduling 87%. 100% felt that they were adequately prepared to work at the clinics, and 100% would work at the drive-thru clinic again. And this is something that we were really excited to hear, because knowing that we put staff in a little bit more of a strained, under strained condition compared to some other static clinics, there was still a lot of positives and a lot of pros to it, regardless of it being quite cold. So we had in the end of day debrief several of our staff that have a long experience in immunizing, noting that there were several clients, more than usual, that came out and indicated that this was the first time they received a flu shot in their entire life. And this was also very exciting for us to hear, because knowing that we're working through the COVID immunization with, potential for vaccine hesitancy, all the potential barriers that can be in place for people to access this type of services, knowing that we might have an opportunity here to access a group of clients that would be hesitant to go and receive the service elsewhere was really encouraging for us. So when we were looking at the staff feedback in themes for the open-ended questions, staff felt that what was most positive, that it was safe and efficient. So they really felt that it provided a safe and fast and convenient way for people to get immunized. They did appreciate the communication that was sent in advance, so that clients had an opportunity to read information and be prepared and know what to expect, as well as them having the consent form provided in advance. They really appreciated the clinic setup and flow, so the open space. It also gave people a good overview to understand kind of what is coming, what are some of the hiccups, and see the flow through the clinic. Suggestions for improvement from our staff, again, was the weather, and as mentioned, we are looking into other options for that. And the consent forms as well, really emphasizing that online consent also has an opportunity to decrease the kind of interactions and handovers required, so that is preferable. They also were talking about staffing resources and to have more staff in certain stations, as well as for the supplies. We had, as you saw in one of the earlier pictures, set up a table with the supplies that were being filled up by our runners. However, several of our immunizers noted that if they would have had a belt or something where they could put like their supplies that they were using all the time with them when they were walking around to access clients on the other side of the car or approaching cars, that would have been preferable, as well as a time or date stamp that they could just stamp the note that they handed to the client when they were transitioning into the post-immunization area. So as I mentioned in the beginning, one component that we really wanted to understand is how does this type of models in comparison to other type of clinics? And knowing that some of the pros and cons really was emphasized through the literature and the experience that we shared with some of our external partners, we also kind of wanted to understand some about the efficiency. And I did speak about it a little bit in the beginning, that there are partners that have really pointed out that with that experience and navigating around potential administrative tasks to be removed or faster, that can significantly increase the put through of clients. So what we were looking at was a comparative analysis between clinic types, so really understanding the opportunity of maximizing the operational flow and processes for each type of clinic, so a static, drive-through, and mobile clinics, and specifically with the lens of COVID, knowing that what we can do in a static clinic in another context is a lot quicker and a lot more efficient than what we might be able to do in the context of COVID, requiring physical distancing, as well as increased cleaning, as well as potential donning and doffing of PPE, et cetera. And so we wanted to understand the resource requirements in comparison, as well as the staff requirements. And this was done with the aim to facilitate decision-making for operational and financial planning. So looking at this, and again, this is based on the 1.5 hour that we ran through most of our clients, and noting and understanding that this can probably be speeded up. So what we saw was that the medium drive-through clinic, over a 6-hour period of time, put through approximately 648 clients. That was with 10 immunizers. And what we would anticipate in a medium-sized clinic in non-COVID times with the same number of immunizers is approximately 750 immunizations to be performed per day. However, with all the measures in place and the requirements for COVID, we do anticipate a significant decrease in the number of clients that we can run through in a static clinic site. Again, the same concept as with the drive-through, with a very effective administrative flow as well as the experience. It's anticipated that we can get those numbers up. However, it's still significantly lower, also because we can have fewer immunizers. As we are planning for immunization in York region and we are looking at our facilities and understanding our safe space kind of distribution of people within a closed area, we are not able to put as many immunizers in the same area and the same size of a room that we would in routine times. So knowing that, we really see that there are some significant benefits with this type of clinic model where we can still utilize and push through a quite large number of clients per hour. And so looking at some of the successes and challenges, so I have been speaking about some of them already, but summarizing it, so with the successes, it was really considered by our staff and our clients to be a safe and efficient way to immunize the clients. It is a feasible model to replicate into other municipalities. So it's a type of clinic setting that, even though it has specific requirements for being able to operate, like you need a large parking space and you need either a closed over area, which is still large enough to put cars through, it's still something that if the weather conditions are right, you can set up this type of clinic in many different places and in many different sites. There's potential to be more cost effective, requiring less PPE and less time between clients, as well as less disinfectant. Definitely by appointment only, we would say would be our only option to operate it in an effective way. Consent form to be sent advance was a success. However, it would even be preferable to have it as an online consent. There was a high level of satisfaction among our clients and staff. We really had some true excellent partnerships, and we did really appreciate working through the different creative and innovative approaches, like running the FM radio station, which was really provided added value. Challenges, again, the cold weather. It was also unfortunate for us because at that day, it was the coldest day of the fall so far. So we had some great weather the day before, but then coming up the morning, it was really cold. So we would have, if we had a little bit more time, we would have looked at the process for enrollment. As I mentioned in the beginning, we had a target population that was staff, family members of staff and residents in our 2 long-term care facilities. And as it was a pilot, we didn't announce it to the broader audience because we did have to the broader public, as we did have a limited amount of spots, and we did anticipate this to be a very popular type of clinic. So that provided us with a little bit of lower number of clients signing up than we had anticipated. But noting really that we don't anticipate that was lack of interest. It just probably wasn't that we had expanded the target population enough in time to get that higher level of attendance. Yes, the same as I've been mentioning before, the lack of online consent form. And I know that we have another polling question, and I'm thinking, Lydia, if you would be able to put the second polling question up, that would be great. So this one here, we just really wanted to see if you are looking into immunization drive-through as an option for COVID mass immunization. Knowing that it's a kind of a subject that's being discussed often, and we are seeing that there is a great interest. As mentioned, we have many partners that have been doing drive-through immunization throughout COVID, but for flu. So it seems to be a model that comes with a lot of pros and also a lot of interest. So yeah, I'm seeing the result that it seems like the majority of the audience are looking into this as a potential option. Thanks, Lydia. So I see a little bit of questions that is popping up, and I did see Kovacs coming up, so I anticipate that will be asked. So I do believe that I have a few slides left just in regards to the outcomes on our next steps. As you probably understood from this presentation, we felt that this was a great success. We are looking into, we have 2 locations in York region currently where we are working on the options of having a drive-through, looking at it from the perspective of the size and the timing and when we anticipate it will be the most beneficial setup. What we are doing as well in the region is that we are navigating around retrofitting, or we have already retrofitted a number of 60-feet buses. And the aim of them are dual. So one is to support our mobile clinics to enable that quick pivoting of reaching different target populations as needed, as well as going into areas where we either might need to support a static clinic site because it's high pressure, or that we need to set up a clinic for whatever with short notice for whatever reason, maybe loss of sight or something else. We are looking at some indoors facilities, and as you can see here in the picture, there is also some pictures from one of our partners in the region, a local physician in Stouffville, who have been working with a hybrid model in Soccer City, where the staff can go inside and then just exit to give the immunization, but they all have all the supplies and everything indoors. So it's a little bit more favorable from a weather perspective and for the immunizers. So my last slide is really just summarizing this up, though I've speak to most of it. So we are looking to include this as our part of our mass immunization clinic setup, and we're very excited to do so. We are developing several scenarios based on the season and time of year. And we are also securing sites for indoor and outdoor drive-through options. And what I just mentioned, we are and have retrofitted a number of large buses to support as mobile clinics, but also to function as an indoor component of a drive-through that is being held outdoors. So basically setting up the retrofitted buses where we don't have an indoor facility where staff can be, and then they can exit into the buses and it be similar to a hybrid model as what we saw in the previous picture. And I do, this is coming to an end of my presentation. I wanted to give a special thanks to Candice Ainstos and Lucy Vallot, who really were the two people who were the driving force behind getting this operation up and running. So thank you.
Great. Thank you so much, Katarina. This is really informative and very timely presentation. The questions in the chat pod that there's a lot of interest. So we'll move into the Q&A section of the session today. We've got some time and we'll hopefully be able to work through as many questions as possible. So I'll just go up here and start at the beginning. Some of the questions that came in when you were speaking, a couple of them on adverse events, asking about what was implemented for managing the risk of AFI. Were vaccine recipients and drivers told to wait in a designated area, which I think you covered. And maybe if you just want to comment on, was there anything observed actually in the clinic in terms of adverse events, any events that needed to be managed, and any observations about that?
Yeah, absolutely. And so yes, we did. We had several discussions with our risk and legal before to ensure that we were meeting all the criteria of what was required. We actually had one of our risk staff, one of the staff representing risk, being at the clinic that day off and running through the clinic to just ensure and kind of identify any potential areas for risks, and keeping in mind that in this area, but in a high pressure environment, what could be any potential issues that we could see. We didn't have any adverse reaction the day off. However, it should be noted that this was flu vaccine, and that might not be the same for COVID vaccine. We know that to the knowledge that we have at hand, we haven't seen too many adverse reactions, serious ones for that either, but it might look different. So we had our staff, we had more staff and had kind of redirected our resources within the clinic setting to the post-immunization area, where we had 3 people that were circulating around, observing clients in their car, as well as requesting the clients to keep their window down, engine off, and honk if they needed any support. So we didn't see anything, but we did put a lot of consideration into that, and that was also one of the main components that we received some really valuable support from our paramedic service partners. We had their ambulance on site, and we had them on site. So they were providing immunization support, but they were also there in case we would have any events where we would want to leverage their subject matter expertise in treating medical emergencies in field and in the vehicle, which our staff don't have too much experience from most of the time.
Okay, that's great. Thank you. And lots of comments about interest in the recording and the slides. So I'll just say that I'm trying to try to get those out as quick question about coming from Niagara there, just about what vaccine you were using at this site. I know you said it was influenza vaccine, but maybe the question is about the product.
Oh, I have to go back and check with our vaccine program. But I can definitely follow up on that.
Okay, moving on to another question. Actually, this is going to be looking into the summer months. How will drive-through clinics manage during the summer when the temperature is much higher, 30s, maybe 40s? And how would you keep the tents cool, or clients turn their cars off when they'll be in need of air conditioning? So maybe that's just something you've thought of in terms of your forward planning.
Yeah, it's a great question, and really we have been trying to navigate around any weather-related issues. So both, yes, looking at the cold, but also the heat. So to add from a client perspective, it's not only the heat is not only a problem for the client, but it's also potentially a problem for the vaccine. So it is something that we are looking for potential kind of hybrid models of indoor, outdoors, or indoor, as well as in our retrofitted buses. We do have refrigerators installed, so we can ensure cold chain management. And for the client, for the staff, I think it's really helpful to have tents set up with sides. As much as they are protecting from kind of cold wind in the colder times, it is also providing shade as a main component, as well as putting on, either if it's cold, you can put in heaters, and if it's warm, you can basically put in fans. However, that's not giving a good answer to the question about the client. From the perspective of kind of having them in the cars and turning off the vehicles, yeah, for sure, absolutely something that we probably need to look a little bit more into. We are kind of generally encouraging them to keep the windows open and so on, but definitely a point well taken that if it is really hot outside, and especially if there are families with small children, that's something to be considered, and maybe something to navigate around the communication with clients before, ensuring that those days we don't have the most elderly and most vulnerable clients coming, and not bringing smaller children, but maybe those who are easier to navigate around and kind of less sensitive for extreme heat and so on. So something I'll take back to us as well.
Great, thank you. Maybe I will go to a question which I'm sure is on many people's minds in Ontario. Have you thought about how to integrate Kovacs with the drive-through model?
I did expect that question. So it's a great question, and it's very interesting. And so we have talked a lot about Kovacs, and yes, definitely our aim is to use Kovacs for all our COVID vaccine, and also in this type of chronic site. We have been very fortunate to have a very close partnership with one of our local practitioners who has been working with drive-through for flu, and she is also knowledgeable in Kovacs. So we actually have received a lot of great input, and I know that she has provided a lot of great input back to the ministry in regards to how we can streamline the use of Kovacs in clinic settings. And it really is looking at to have it, and that was much of my points when talking about ensuring a removal of administrative barriers within the clinic flow, which is the same for a static clinic or drive-through. It's just removing all those redundancies. And hopefully, once there's a client booking component in Kovacs, that we also have a huge support of that, and clients putting in their information into the system prior to arriving to the clinic. And then the feedback that has been provided back in regards to how to utilize Kovacs in a drive-through really looks to simplify it, to ensure that our staff don't need to enter in data on multiple locations in the system, but they're actually able to kind of print the slip for confirming immunization at a specific point of the drive-through, and then have that kind of just signed off by the immunizers, and really ensuring that that there are a few administrative components while still meeting the need for adequate documentation.
Lots of interesting, varied questions here. Question about insurance, and did you encounter any issues with getting insurance for this type of event?
So we did all that through our internal risk and legal department. So I can't speak too much to the details of insurance, but we had a lot of good walkthroughs and conversations with our legal and risk partners, and they looked into all the different components and the requirements to ensure that it was meeting the insurance needs and all the different risk components. And one thing that I should mention that I think was really helpful for our regional staff that was supporting us is that we put together a quite comprehensive pilot plan, so much similar for any emergency management people on the call, that when we do a pre-exercise kind of planning and really putting into documentation, outlining the roles and responsibilities, outlining the potential issues, the mitigating strategies, kind of the time flow and the sequence of what we are expecting to happen. And then we provided that to our partners that was collaborating with us. And I think that was a part that gave them a lot of insights in regards to how we are planning to solve certain issues and how we were navigating around. And it also enabled them to look at it from an insurance and risk perspective. And we had all of those players review that document before we started to operationalize the pilot to ensure that they feel comfortable from a risk and safety and legal perspective and all those different areas. So we received a lot of great impact, both from health and safety, risk and legal, and ensuring everything with the consent and everything was in place. So we just had everybody at the table kind of taking part in the planning piece and ensuring that they had an opportunity to raise any concerns or issues at an early part in the planning. So we had an opportunity to navigate around that in a timely way.
Okay, that's wonderful. I think you touched on this about the time frame. What was the time frame from point of vaccine administration moving to the post-immunization assessment station? So maybe you could just do a quick recap on the timeline.
Yeah, for sure. So specifically between the immunization station and into the post-immunization area, there they went directly. It's a very close kind of in proximity. So it's basically maybe like 10, 15 meters to get into the area where you're entering the post-immunization area. So from the entire process, from entering, kind of reaching the greeter until they reached the post-immunization area, that was an average of 10 minutes and 11 minutes of cars with multiple clients. And again, that's really something we anticipate that we could speed up and do quite a lot quicker if we have a very good flow for, Kovacs use within the clinic, getting as we kind of gain the experience, just knowing that how the flow goes. I think it has a good opportunity to speed that up. But there was no time frame between the point of immunization until they went into the recovery area, and the 15 minutes waiting was in the recovery or the post-immunization area.
Okay, maybe another question that builds on that a little bit, but maybe thinking more broadly about what your approach is to refining and conducting some continuous quality improvement after this pilot, and then thinking through to this potential upcoming program. And is there any particular methodology you're using for that?
Sorry, Tara, can you just repeat, because I lost connection for
Sure.
Sorry about that.
Sure. So the question is around your approach to refining and conducting continuous quality improvement after the pilot and then throughout this upcoming program. And is there any particular methodology you'll be utilizing for that?
That's a great question as well. So we have taken a really deep dive into the survey results that we received to really ensure that the setup and the operational running of the clinics moving forward is working around, navigating around, and incorporating all the lessons learned that we received from the pilot. And so we work very closely with our program evaluators and everyone internal to the region to ensure that we incorporate kind of the customer lens perspective and keep increasing that as we move along. At this point, we kind of, as we're navigating around the sites that we are going to use for drive-through. So we're also looking specifically at those individual sites, because much as I've been talking about during the presentation, it's a lot of themes that are general, just kind of looking at the operational flow, and then there's also the site-specific components. So knowing that we were very well served by having an indoor staff lounge for staff in close proximity to where they were working if they need to be outdoors, much of the lessons learned really around the weather pushed us to look further into other options, so hybrid versions or indoor drive-through to navigate around that. But we are working kind of continuously with our program evaluators and our customer service assessment people in the organization, just to ensure that we continue to assess and incorporate the lessons learned, specific from what came out of the pilot, but as well as what is unique to the different sites that we are looking at.
Thanks. There is a question about the one slide you presented that did the comparison of the drive-through clinic to static clinics. So the question is about the number of immunizations per hour and the staff at the medium static clinic, and what was the source of the estimate for that piece?
So we looked in the source of the estimate. So there were two parts that we looked at to come to that conclusion. So one was what we have been doing through COVID in our own clinics. So kind of like within York Region Public Health, as we have been running the catch-up for grade 7, grade 8, as well as flu throughout the last year. We really looked at the clinic setup and what they were able to navigate around in regards to safe space and the number of immunizers and the number of clients that they had in those clinics, as well as the type of clinics that we were running pre-COVID. And we also went to the literature to really go and get a little bit of a broader insight into what is the anticipated speed, so to say, of running people through this type of site in different scenarios. So it's a mix of what is in the literature and kind of, if you run a clinic in this format, if your immunizers do X but not Y, and et cetera, what then would be the speed to run people through. So both kind of based on our own experience and the setup of our clinics during COVID, but also what we saw as lessons learned and what has been outlined in the literature.
You might have time for one more question, just scanning to make sure we've covered everything. There was one comment about potentially using this for other programs. So maybe I'll ask, has there been consideration in your organization? I know COVID is on the minds of everyone, but probably lots of other programs to catch up on, like school-based vaccines. So just wondering if there's been consideration to utilizing this going forward for other programs.
Yes, I know that we haven't done it ourselves, but we have partners in the region that have been done drive-through like testing, so COVID swabbing basically as one. And one thing I think too that we also consideration, we haven't had the discussion, I think also just based on everything being COVID focused right now, where we could take this type of format moving forward. One point to consider is that your target population matters, and that's also kind of why it's part of a bigger what we refer to as a flexible hybrid model, offering different types of sites. And what we have done in York Region is that we have really looked at our ESSI data, we have looked at our demographic and socio-demographic data, and overlay that in maps to ensure that the type of clinics we offer in various areas is suitable for the population in those areas. Because if you offer a drive-through clinic to people that don't have cars, you're going to put yourself in a bit of a problem. So for example, either people won't show up or they start to carpool. And that's kind of not exactly what we would like to encourage. So we're just really mindful of what type of activity and what our target population is for this type of clinic. So I'm quite certain that it would be a good fit to translate into a lot of other areas. We just haven't really got there yet beyond COVID, as being very focused on the COVID vaccination at this point. But it's a great point, and it's a very favorable methodology for many things, and it provides kind of a lot of benefits that I see would be useful beyond the COVID context and hopefully after this as well. So I'm sure that there will be continued discussions in regards to utilizing this type of clinic beyond vaccine. But again, I know that there are kind of a COVID swabbing occurring as a drive-through in several areas.
Okay, great. We're almost at time now, and maybe that's a good place to end in terms of thinking about tailored approaches for different populations. So thank you very much, Katarina, for your presentation today and being so generous with answering all of the questions. And thank you to everyone who's joined today. And it's great to have a lot of participation and great to see that in the chat pod. So if you can all ensure to complete your evaluation from this session, we would really appreciate that, and also ask you to reflect on how the information provided in this session be used in your current work.